Do these medications, that is, does GLP-1 medication like Ozempic, Wegovy, Mounjaro, Zepbound, and others cause thyroid cancer? And I'm going to give you a simple answer as well as a nuanced answer. Now, what do we know about thyroid cancer? If you are already having an existing thyroid cancer or prior history, or if you've had family history of thyroid cancer and you have another diagnosis, which could be treated with GLP-1 medication, then my friend, let's dive into it. Now, GLP-1 medications are contraindicated, purely contraindicated in patients with personal or family history of medullary thyroid cancer, MUDULLARI, medullary thyroid cancer. And one of these conditions, which is genetic, is called multiple endocrine neoplasia syndrome type 2, MEN type 2. That is an inheritance in the family where these individuals tend to have medullary thyroid cancer. So there is any family history in regards to this specific thyroid cancer, GLP-1 medications are contraindicated. Now, why is that? We have a black box warning on all the medications which are specifically GLP-1 or GLP-1 and GIP. What we've seen that this is all based on rodent studies showing C-cell tumors, and we have C-cells in our thyroid gland, and C-cell tumors are leading to medullary thyroid cancer, and that's why it's a black box warning, because we've seen those cases in rodents, in animals. Now, the differentiated thyroid cancer. So if you have other family history or personal history of thyroid cancer, which comes into the category of differentiated thyroid cancer, which is papillary thyroid cancer, follicular thyroid cancer, and there are many subsections to it. In those scenarios, there is no evidence that it is directly a causal factor for causing these kind of thyroid cancers, the differentiated form. Again, we don't have much of an evidence, and it is not clear if there is any direct correlationship between taking GLP-1 medications and inducing any of these types of thyroid cancer. So there is no established contraindication for use of GLP-1 medications in patients with history of differentiated thyroid cancer like papillary thyroid carcinoma, and we don't have any evidence which suggests that there is a direct correlation or contraindication. So the best way would be have a discussion with your endocrinologist or with your physician about this specific question and this specific difference between medullary versus thyroid cancer. So I wouldn't shut the doors for my patients who have history of papillary thyroid cancer, be it personal or family, and if they have a medical indication to use GLP-1 medication and they would like to, this is the discussion I would have in regards to the safety, what we know in science, the contraindications.